Hello, I'm Jan Mold. I'm an Assistant Director for Competitive Events for HOSA-Future Health Professionals. I also spent 24 years in the classroom as a teacher in health science and also as a HOSA advisor. The topic I'm going to talk with you today is HIPAA. I know it may not be the most exciting that we'll do, but it is one of the most important. It's the last day of clinical class for CNA students. They're high school students. They're excited about the end. And somebody says, let's take a selfie. We're all here in uniform at the nurse's station. So everybody agrees that that's the perfect idea. As the picture's taken, the long-term care administrator walks by and says, did you realize the patient was in the background of the picture you just took? A HIPAA violation. The long-term care administrator decided to use it as a teaching moment. The picture was deleted, but it could have had extremely negative outcomes for both the students and the high school as not having been able to return to that facility. So it's real important that you understand the HIPAA rules and are able to follow them as you go out into a clinical setting. You've been provided with a video guide. The video guide goes along with this 7.5-minute video. It is full of information on the Health Insurance Portability and Accountability Act.
HIPAA stands for the Health Insurance Portability and Accountability Act. Its original purpose was to protect people from losing their health insurance if they change jobs or have pre-existing health conditions. HIPAA has been expanded over the years to also help reduce the cost and administrative burdens of healthcare transactions, and most recently to develop standards and requirements to protect the privacy and security of personal health information. It's HIPAA's privacy and security rules that we'll cover here. HIPAA's privacy and security rules require healthcare organizations to adopt processes and procedures to ensure the highest degree of patient confidentiality. It makes sense. Patients desire their information to be secure and rely on you to keep it safe and confidential. Personal health information, or PHI, can be created, stored, or transmitted in many formats through verbal conversations, written documents, over computer software or hardware, and in various other forms. All require security and confidentiality measures to be implemented. PHI may include anything in the patient health records, such as lab results, medical history, images, and more. It also includes other patient information like names, birth dates, social security numbers, email addresses, and other information that can be used to create identity theft. It seems like every day we hear about another data breach. Keeping patient information safe is what HIPAA governs and what you are responsible to protect. A covered entity under HIPAA may not use or disclose protected health information unless a patient authorizes its disclosure in writing. However, we may disclose protected health information without an individual's authorization for any of the following purposes or situations. 1. To any individual that has been authorized by the patient. 2. For treatment, payment, or general healthcare operations. Or 3. If the individual has the opportunity to agree or object to a disclosure. For example, when the patient brings another patient into the exam room. In addition, all practices are required to provide patients with a Notice of Privacy Practices, NPP. It is a best practice to make a good faith effort to obtain a patient's written acknowledgement of receiving the notice. The NPP must inform patients of the uses and disclosures of PHI that the practice may make and define the patient's right to access and amend their medical information. Except in certain circumstances, individuals have the right to review and obtain a copy of their protected health information. You may impose reasonable fees for the cost of copying and fulfilling the patient's request. When you disclose PHI, you must use the minimum necessary information to accomplish the purpose of the disclosure or request. Practices must identify each employee who needs access to PHI to carry out their job, and PHI should be limited to a need-to-know basis. For non-employees, you must limit the amount PHI of what is needed to accomplish the work. You should also rely on ethics and your best judgment in deciding whether to disclose protected health information. The HIPAA security rule requires covered entities to implement administrative, physical, and technical safeguards to ensure that medical information is stored, transmitted, and received in a safe and secure manner. Administrative safeguards require practices to create and maintain updated policies and procedures for employees to learn and follow to help maintain the security of PHI. Some examples of administrative safeguards include acceptable use policies to help train employees on their access rights and responsibilities with handling PHI. Sanction policies are needed to discipline employees who violate HIPAA law. Information access policies grant appropriate access to computer workstations, health records and transactions, and other programs or processes. Security awareness training must be implemented, so employees are trained and reminded of policies and procedures relating to software updates, computer login monitoring, password updates, and other key security measures. And contingency planning, so adequate preparation, policies, and procedures are in place in order to respond to an emergency. For example, if there is a fire, vandalism, or other natural disaster, an incident and emergency response plan must be created, tested, and revised, and all critical activities must have a designated owner. Technical safeguards require practices to implement procedures and the right software and equipment to protect PHI. Practices must implement technical policies and procedures to allow access to only those people who need access to do their jobs. Practices should incorporate encryption and decryption in backing up, restoring, and transmitting electronic patient information. And policies and procedures must be set up to destroy PHI when it is no longer necessary to fulfill a job or function. Physical safeguards must be implemented to protect the location and devices within your practice. Facility access controls must be created, and all access must be monitored. It's important that you understand and monitor who is accessing the practice, and security measures are put in place prior and after a potential incident. To help administer these safeguards, HIPAA requires that every practice designate a HIPAA security and HIPAA privacy officer. The designee can be the same person, if appropriate. The HIPAA security and privacy officers play key roles in leading the implementation and training of HIPAA requirements for your practice. HIPAA is enforced by the Office of Civil Rights, a division of the Health and Human Services. Penalties can be up to $50,000 per penalty per violation, and increase up to $1.5 million per identical penalty, or willful neglect in any calendar year. Civil and criminal penalties may apply depending on the offense. In addition, with the enactment of HIPAA's Omnibus Rule in September 2013, covered entities were expanded to include your business associates, which include auditors, consultants, IT companies, and others with whom you have agreements involving the use of protected health information. That means when a doctor takes notes in a medical chart or an assistant, data enters health information into a report or online program discussing a patient's condition. Any entity that also is in contact with this information is now governed under HIPAA. HIPAA requires that updated business associates agreements are executed between the practice and all business associates. It's important you do everything necessary to protect your patient's private information and to comply with the HIPAA security and privacy rules. The practice's reputation is at risk if you violate HIPAA law or if patient information is compromised. Penalties can be devastating, and it's your duty to contribute to a commitment of developing a culture of compliance and data security for your practice. If you see any suspicious activity, please report it to your supervisor as soon as possible. Thank you for participating in today's HIPAA training. Please follow up with your supervisor if you have any additional questions.
These apply to you if you are a student in a clinical setting as well as to their employees. So let's talk about another case.
The Summer 30. Now, Mel, today is a very special day.
Yes.
It's the day that a lot of people have been waiting for a very, very long time.
There's been speculation for months that Kate Middleton, married to Prince William, is pregnant. And
Yes.
it has been confirmed that she is pregnant. She's in hospital with severe morning sickness, poor little dear.
The thing is, though, that this condition that she has is often attached to women that are having twins. So maybe not one, but two royal babies.
I would rather pump out a couple at a time. Makes it easier,
You make
I think.
it sound so special and emotional. I'd rather pump out a couple. That'd be all right, wouldn't it? Have someone in the corner of the room with a baseball mitt catching them.
Yeah,
And pump them out. Here's the thing. We've been handed a phone number, all right? And we have been told that this phone number is the hospital where Kate Middleton is currently staying. Now, we thought we'd give it a call. We don't want to cause any trouble.
Yeah.
We don't want to stress her out because she's doing it tough.
Yep.
But I reckon we can maybe get her on the radio tonight.
Look, I don't know. I mean, everybody would be trying
Well,
this.
this is why I thought of a plan. We can't just ring up and go, "Hi, it's MC and Mel from the Summer 30. Can we chat to Kate?" Hang up. Not going to happen.
Yeah.
You are going to be the Queen.
This is awesome.
I'm going to be Prince Charles.
Hello, I'm the Queen.
Ben and Em, you're involved in this as well. We thought that maybe you could be the royal corgis, if you're okay with that. Yes, exactly.
Sure, we'll pop on in a sec.
Come into the studio.
Yeah,
I'm going to dial this number.
This is fun. Oh, I mean, this is fun.
Yes, yeah. So you're going to be the Queen.
Hello, I'm the Queen.
Hello, Prince Charles over here,
Oh, you're
mummy.
Prince Charles. I like your ears.
And Ben and Em are going to be the royal corgis. So let's
be serious.
let's give this hospital a call
Okay.
and see if we can get Kate Middleton or maybe even Prince Wills on the phone tonight. So the number's going in. Oh, jeez, I hope this happens.
Hello, good morning. King Edward VII Hospital.
Oh, hello there. Could I please speak to Kate, please, my granddaughter?
Oh, yes, just hold on, ma'am.
Thank you.
Are they putting us through?
Yes.
If this has worked, it's the easiest prank call we've ever made. Your accent sucked, by the way. I just want you to know.
I'm not used to playing old 80-year-olds.
What about this one?
Kate, my darling, are you there?
Good morning, ma'am. This is the nurse speaking. How may I help you?
Hello, I'm just after my granddaughter, Kate. I want to see how her little tummy bug is going.
Mummy.
She's sleeping at the moment, and she has had an uneventful night. And sleep is good for her as we speak. She's been giving some fluids to rehydrate her because she was quite dehydrated when she came in. But she's stable at the moment.
Okay, I'll just feed my little corgis then. So when is a good time to come and visit her? Because I'm the Queen, so I need a lift down there. Prince Charles!
Mummy, is everything okay?
Oh, wait, my Charles, when can you take me to the hospital, Charles?
When will it be all right to come down and see her? Maybe in the morning or something, if that's okay.
I would suggest that any time after 9 o'clock would be suitable because the doctor will be in the morning.
Okay.
And we'll just be getting her freshened up in the morning. I would think any time after 9.
Wonderful. And is Will still there? Has he gone home? I haven't spoken to him yet.
He went home at about 9:30 last night. No, actually probably about 9 o'clock last night.
Okay. Lovely. But they're all okay? Everything's all right?
Yes, she's quite stable at the moment. She hasn't had any retching with me since I've been on duty. And she has been sleeping on and off.
Wonderful.
I think it's difficult sleeping in a strange bed as well.
Yes, of course. It's hardly the palace, is it?
It's nothing like the palaces of Charles. And when are you going to walk those bloody corgis?
Mumsy, I'll go and take the dogs outside.
I need to go visit Kate in the morning. My dear, thank you so much.
You're very welcome.
Thank you. Bye.
Goodbye.
Bye. She's given us real information.
Mumsy, I think that they believed everything that we just said.
I am the Queen. Bow for me. Bow for me.
Bow for you.
So these two radio personalities decided to play a prank, pretended to be the Queen of England, and were given protected health information by the nurse that they reached. This case got a lot of publicity when it occurred in 2012. It was a really sad case in that the nurse that talked to them ended up committing suicide 3 days later. HIPAA is extremely important. So let's talk about the most common violations that might apply to students. One is snooping on healthcare records, and this is from the HIPAA magazine. UCLA Hospital was fined $865,000. The records of Britney Spears and Maria Shriver were accessed. Again, you've got to make sure that it's a need to know, not a want to know. And with celebrities, I think that we all think that we should be able to get their information, but that is not the case. Disclosures of PHI, filming without a patient's consent in New York Presbyterian Hospital. A patient came into the ER, there was filming going on. They did not obtain permission from that patient, and the family sued, and the award was $2.2 million. A fax disclosure of HIV status to an employer by Luke's Roosevelt Hospital Center resulted in a $387,000 fine. Improper disposal of PHI. Parkview Health received $800,000 penalty for not disposing of paper records securely, and that is by shredding for most facilities. So here's an opportunity for you to make the call. A nurse posted on Facebook, "For the first time in my career, I saw measles this week. Actually, most of my coworkers and the ER docs saw measles for the first time as well. And honestly, it was rough. The kid was super sick enough to be admitted to the ICU, and he looked miserable." Would you consider this a breach of confidentiality? It was considered a breach. The nurse was fired. And even though she didn't use the patient's name, which I think most of us think if you don't use a name, it's okay, but there was enough information there that it was felt that there would be folks that knew who she was talking about. Release forms are very important in our health career photography event. We have those included to make sure that the HIPAA rules are followed. And this to the right is an example of one of the pictures that was submitted by last year's secondary winner. So hopefully you got it. We're going to give you an opportunity to see how much information you got. There is a quiz, and it is a pretty lengthy quiz. There are 50 multiple choice questions, but I think it'll give you an opportunity to see how well you got the information. Again, I can't stress enough how important this information is. Thank you for your time.